Welcome to the Research Works podcast, brought to you in association with the Healthy Strides Foundation. Your hosts are Dr. Dana Poole
and Dr. Ashleigh Thornton, and we're here at the AusACPDM conference in Cairns, Australia, to interview world-leading researchers, clinicians, and people with lived experience
to support your practice in being more evidence-based.
Welcome back, everyone, to AusACPDM. We are joined by research fellow and occupational therapist Ashleigh Hines. Welcome, Ashleigh.
Thank you so much.
Welcome. So lovely to speak with you and to talk about your paper, which definitely caught both of our attention. Wait till I say it, and you'll definitely all know why. So your paper that you're presenting here at the conference is titled "Parents' Experiences of Early Intervention for Infants with or at High Risk of Cerebral Palsy: A Qualitative Systematic Review."
That's right.
Great title.
I'm so excited to talk about a qualitative systematic review.
They're not that common.
They are not. No.
They seem really hard.
Yeah. Someone said that to me today. Qualitative work's so much harder. And I was like, I'm not so sure about that.
Yeah.
But I guess we all have our strengths.
That's right.
But yeah, we just wanted to really bring together all of the wonderful words of parents that are around in all of these qualitative papers and bring them together in one place.
Yeah. So let's talk a bit about, the broader context for this work. How did you end up at the point where you were doing a qualitative systematic review about parent experiences?
Yes, and I think it's so important in qualitative work to talk about your author, like who you are, because we all have biases that we bring. So I am an occupational therapist. I would say that first before I'm a researcher. I was like, big part of who I am. But I work with parents in early intervention and at our early diagnosis clinics in Sydney. So I guess there were 4 points of background that I think in my head that CP diagnosis is happening earlier. That we know that even when expected, a diagnosis is a time of stress, grief and uncertainty. But yet as therapists in our international practice guidelines, we're sort of taught that early intervention should start straight away. We should get in there. Particularly for things like motor and cognition. And then the fourth bit is that parents are vital in a part of that. We're taught a lot about parent coaching, collaborative goal setting. And so I just felt I was like, wow, this is a lot on parents and on clinicians to make this happen.
In a relatively timely manner, if we're talking about.
Exactly. And we know there's a window of opportunity. So there's that sort of pressure. We've got to get in and get started.
And when you consider, I love how you set that out, because out of all of that, whilst we know early intervention, early detection, let's go get going with it. But during that phase, there is just so much grief as well, because it's what's really, I guess, quite normal is not the right word, but I think you know what I mean. It's part of our practice, it's what we do each day. But for each family that come through, it's a new experience and
it's their first time.
That's right. It can be really confronting and emotional.
And I think that would lead me into the first 2 themes of our results. I don't know if it's too quick to go into that.
Let's go into it.
No rules here. Right?
No rules.
But in talking about the diagnosis and how those emotions are lasting, which is a quote from one of the papers, in that these families are, there's the unknown, there's the uncertainty. Parents talk a lot about how information was received. And then there's that, the second theme that we report on is that their family life or daily life has been altered. So it's a challenge to fit it in every day. They're just it's overwhelming, these people that they meet, the appointments they have to do. And there's sort of a guilt. Some parents report feeling guilty that early intervention is seen as just one more thing to fit into the day. And sometimes if your baby's, one mum said she knew the importance of prone, but her baby was so upset. So she felt like she spent the first 2 years around the house singing to her baby carrying her. So, and then she said, so as far as early intervention goes, there was no way. And I'm just there's so much. There's so much going on.
There's a lot anyway with a newborn. And you're tired. And there's so much that comes with that, let alone the fact that you didn't see this coming and it's a new part of your life, and we're saying how important it is. And you can see why
the pressure people must feel to keep up with everything they're meant to be keeping up with. and also getting to know this little person who's come into their life and trying to make sense of it all must be so overwhelming.
And when they were talking about the delivery of how information was provided, can you expand on that a bit more? I mean, I feel like I can make a guess here because I've heard these two.
Yes, I think some parents talk about being a bit blindsided or that it's said but not said in a way. Maybe it's sort of, or there's assumed knowledge. So, yes, how they received information about cerebral palsy specifically, maybe a lot of other terms might be used. And, or, and as clinicians, we're, conscious of the stress and grief that they're going through and how they can listen and understand in that moment. But I think they're strong memories and strong moments for families, and the words that we use are really important.
It's kind of like what Rachel Burns said this morning in the Ask Me Anything early intervention, and it's we need to go out and get these communication skills. Yes. They're not skill sets that come as part of our course, but it's part of how we deliver information, and it can't be our discomfort that means we sort of don't deliver it in the right way, because the words have meaning and the person on the other side has to receive that.
I think about Sue Ann Davidson's paper around this topic as well, and one of the quotes that she often talks about from a parent is, this is your job, but this is our life. And it's
absolutely one day at work for us, and I agree with that.
Like you say, the effects of that interaction can be long lasting. So before we get into, because I have lots of questions about qualitative systematic reviews, I don't feel like now is the right time to get into those. I'd like to hear about the other themes.
Methodology is really boring anyway.
Actually, that came out of this review. You touched on those first two. What else did you find as part of that?
So there are 5 main themes that I'll talk to. I've mentioned 2 already. The third one was so strong. It came up in, I think, 14 of the 18 papers, that parents will do anything they can for their infant. They don't want to leave anything to chance. They don't want to leave any stone unturned, that they will, for their baby, do what they need to do. It makes me think about that vulnerable place of grieving, coping every day, having busy lives, but then feeling like, oh no, but I will do it.
This pull to, to spread yourself so thin to fit it all in.
The fourth one, parent-therapist relationship. And it's interesting because in qualitative research we do have trustworthiness to try and to show the rigour of our work. And one of them is sort of keeping a diary and meeting as a team regularly, which we did. And I had to be so careful with my biases because I read a couple in a row. I think there was only 2 papers, and parents mentioned friendships. Like the therapist became my friend. It was a social contribution that I valued. And my instinct was like, oh, whoa, no, that's maybe not what I want in terms of my therapeutic relationship. And so then I had to go back to the team, and they were like, well, actually, let's look at the data in vivo. You've got coding and you've got numbers, and actually, parents doing everything they can was in 14 articles, and therapists as friends was in 2 or 3. So when you look at it all, so that's why I really had to be like, even though I had a strong reaction to that, and it's sort of made me think about it, it wasn't sort of across all of the papers that we reviewed.
That's a really interesting one, and I'm glad it's come up as well, because we don't often talk about it. We're caring individuals. You tend to be when you're in this area. If you're not, I don't think you survived. I don't think you can be in this area.
That's right.
You hear people's stories, and stories are so powerful. It's often what bonds people.
And it makes sense when I spoke about this before, I linked it to the self-determination theory, which is my favourite theory. But it's about autonomy, competence and belonging, and to have those needs, we're more self-determined. And so I can see how in belonging, I think some parents reported that the friends that they had or who have typically developing babies, it's hard to link in with them, and being with parents who get it, there's value there. But having someone come into your home, which is often the type of intervention that I do, celebrating small gains, providing emotional support, trusted information, I can see how that need for relatedness can come through that therapeutic relationship.
And that's the parent perspective as well. I suppose that perspective might be different for the therapist, but like you say, that's how the parent kind of interprets that relationship at that point in time. With time that might change, but that's, just one perspective on that
one
dynamic,
perspective of those parents in this early intervention time.
That's right. That's right. So that was the fourth theme?
Yes, and there's one more. Yeah. Very good.
Yeah.
The last one is motivation from progress. So that's parents talking about how they were motivated to persist and persevere when they noticed improvements in their infant. And it was, some of it then referred to goal setting and the value there. Some parents reported about how it's hard to set goals sometimes, and there's one about there wasn't really that time to celebrate. It was like, what's next, and or just not knowing what to set for a little baby. A lot of parents said that was really hard.
Especially when it's, I imagine, and I don't know whether this level of detail was kind of pulled out, but where that child sits in birth order, like if that's your first baby and that's your first experience of parenthood, you really have no idea what you should be not asking of this baby, but what is achievable and what's not, and what's realistic for them. So
I think that's a really good point, and I think most of the qualitative authors acknowledge that in their demographics that would have been one of the things that was listed, but it wasn't in all of the papers.
Gosh, you got some great themes there, and every single one of them as you go through, I'm like, I can see, you can relate to it so easily. I mean, I want to talk more about that, but I do want to swing around. Can we go talk methodology a little bit?
Yes. So,
I think it's worth it. Yeah.
Qualitative systematic review, not something that everyone will be familiar with.
No.
Lots of things that I really like in there. Qualitative studies and systematic data gathering. And so, just talk us through your process really quickly and how you ended up with these themes.
Yes. So our research question was about what are the experiences of parents who have participated in early intervention. And I think there's so many things we should be asking parents about. Our scope here was that they participated in early intervention. And so we sort of described early intervention as therapy support with an allied health practitioner, so OT, physio and speech, and that most of the infants were at least 50% between 0 and 5 years old, and 50% having a diagnosis of CP or at risk of CP. Sometimes the age was hard. The participants of the paper were actually parents, so sometimes I'm like, I know how old the parents are, but I sort of need to know also how old the infants were and at what time they were interviewed, so that can make it different. So that was sort of the research question that shaped the articles that we included. And so then we were looking for qualitative papers that had some type of thematic analysis in it. And so, what we wanted to do was bring it all together in one place. And so I think in terms of a qualitative systematic review, they aren't common. There's a lot of bias involved. And I mentioned it before, but the elements of trustworthiness is where and almost all of the authors did report on trustworthiness, and it's like one of my favourite parts, apart from the results obviously, but I love reading who the authors are.
That reflexivity.
And the reflexivity, it's when you get to meet the chef before you have the meal, who's put this together and what are their perspectives, because the reality is if you guys did the same systematic review, it would look different. That's just being upfront with that.
But I think that adds to the richness of the review and the findings as well. I think sometimes people, when we talk about reflexivity, which is, for those who aren't familiar with the term, I suppose the personal context that the authors are bringing to the research and how that might influence how they interpret things, or how the experiences are shared within the paper. It's really interesting and really important context, because like you say, the three of us could conduct the same review and in exactly the same way and look at all of the same quotes and think slightly differently about things. And that's the beauty of qualitative work, I think. And as long as you're upfront with it and open about it, that's the rigour. And
there's 4 of us on the authorship team, so all of us are clinician researchers. One of our authors has an infant with CP, so she's currently doing early intervention. So it's been really interesting in our peer debriefing sessions to get her perspective on it as well.
Wow.
Yeah.
So with this in mind now, and it's such a great piece of work. Where to? Like, how are you going to use this to inform your next steps?
Yes.
I'm sure there's a next step already.
Yes.
I can tell by the sparkle in your eye.
I know. Yeah, always, exactly. Well, I think we should always be evaluating our work in a qualitative way. Like, I think parents' words are so strong. And I think most of the papers were evaluating a specific program, like Small Steps or Elevate, but then some of them just look generally at early intervention, and I sort of like that because it's important to evaluate program, but also I think generally to check in with parents without being linked to an intervention is important too. And then I think in terms of other clinical take-home messages, I often think, I come back to that theory, which I know can be a bit like, it's a bit like, frameworks and theories for a clinician. It's like, what's it?
We like structure.
We like structure.
Yeah.
And so I think if you're working with a parent in early intervention and you think maybe that engagement piece isn't there, which is crucial, often I think through like, okay, do they have opportunities for relatedness with other people? And in terms of competence, like, can I help to coach them in a way that is learning for them and that they value and give them choice? Like, where do you want these therapy sessions to take place? And remembering that.
I love that.
Take away.
I think often when we talk about empowerment, really what we're talking about are those elements of self-determination theory.
Right.
So,
And empowerment's like a buzzword, right?
Yeah.
Engagement, empowerment.
Yeah, exactly.
But there's a theory that sits behind it.
Yeah.
There you go. It's very valid, very important.
Yes. Ashley, thank you so much for coming on and talking to us today. I think it's so clear how passionate you are about this topic and this work.
I knew passion. I was at high risk of ramble, so hopefully
No, not at all. You were very clear and succinct and explained it all beautifully, so thank you.
Thank you so much.
Thank you so very much. And to all of our listeners, gosh, that was a great one, wasn't it? So I hope you enjoyed that, and we'll talk to you all again really soon. Stay tuned. Bye.
Bye.